Uganda is still grappling with high burden of malaria despite numerous interventions put in place. World Malaria Day aims at highlighting burden of the disease to the world. This year's theme is accelerating the fight against malaria for a more equitable world. The commemoration attracted top officials of Ministry of Health, the Executive Director of Global Fund, Deputy Speaker of Parliament, local district officials of Kibuku district, among others. Thomas Tayebwa called for new strategies to tackle malaria in the country.
I want to urge local governments everywhere and leaders that science cannot be mixed with politics. Politics should only come in to facilitate science to do its work. So the time we wasted arguing with the minister and all that, how many people did we lose? I hope now we run that when the scientists develop a strategy, we as leaders, we should only come in to support their efforts. Because science is not for debate. A counselor cannot be debating with a doctor on issues of health here. You can't.
In the malaria vaccine this year. However, what we have been given will only cover 105 districts, not all the 149. And we shall start with the high burden districts. It is given 4 times. And again, I'm repeating that because many times when vaccines are given more than once, people don't turn up. Please turn up and get all the 4 doses. It is for the children under 5.
The Executive Director of Global Fund, Peter Sands, expressed their commitment in funding the move to end malaria epidemic in the country, while the Permanent Secretary of Ministry of Health, Dr. Diana Twine, called for intensified research in the health field and community engagement.
Over $1.1 billion to fighting malaria in Uganda. And in the current 3-year cycle, we're committed to investing another $267 million. This makes
continue to leverage on the support of the partners. But we need to be more coordinated that now the threat is real of malaria. We need to be coordinated, we need to do more research. We need to intensify to answer the questions that we cannot wait other people to answer these questions for us.
The in charge of Kibuku Health Center 4 noted that the facility registers high numbers of malaria and sickle cell anemia patients.
One of the major cases we see here, and our service points need managing most of the malaria. And our positive rate here is about 70%, meaning out of the 100 patients who come and screen positive for a fever, they turn out to be having malaria.
Zahara Bigaba compiled this report.
Malaria. What a killer disease.